My name is Teddy. I'm a clinical research fellow with the Global Surgery Unit in University of Birmingham. So I think we all know this already. AlliGatOr is a global prospective cohort study. We are including both adults and children, and the main aim is to identify gaps in the emergency care pathway and to make recommendations to improve these gaps. Some of the important things to take note of is the fact that we would be, we aim to start data collection in the first week of February, on the 3rd of February. And this would be in 2-week blocks of 16 weeks. And it would involve taking data from consecutive patients presenting with or having surgery for appendicectomy on account of confirmed or suspicious appendicitis. So I just made a brief outline. I've gone through the study summary briefly. The things to highlight today would be the sub-studies, mini-team registrations, REDCap, how to sort that out, and then we'll talk about the hospital level surveys as well. So these we've already gone through. If there are any questions, burning questions, you can put them in the chat and we'll pick that up. But I'm keen to just quickly go to mini sub-studies and then to the mini teams. So we said last week, for those who are around, or in the protocol as well, we've said that we are including 2 main sub-studies in this particular cohort study. There's one on financing and there's one on waste management and sustainability. So the financing sub-study is aimed at evaluating catastrophic expenditure in patients who are undergoing appendicectomy. And then we are also comparing cost of open versus laparoscopic appendicectomy in that particular sub-study. And then the second sub-study is on waste management and sustainability. And this is really to characterize what the current sustainability practices are currently in use in operating theaters across the world. And it's focusing mainly on waste management. Now, the financing sub-study is only open to centers in the NIHR hub countries. The waste management and the waste and sustainability sub-study is open to everyone across the world. I'll go a little bit more into details with this. So regarding the sub-studies, we know that the main data collection will be done by mini teams over blocks of 2 weeks. So this mini team 1 will take data for the first 2 weeks, and the next 2 weeks will be team 2, team 3, team 4, team 5 to team 8. Now, in certain centers, you may decide that you would maintain the same mini team that would collect data in all the 8 periods. For other centers where you have more junior doctors and even perhaps medical students, and you want to include them in the study, then you may want to vary the people collecting data for the different periods. But that's entirely up to you. It's your choice as a hospital lead to make that decision. Now, the thing I want to highlight here now is that for the sub-studies, for those hospitals who want to be part of the sub-study, you have an additional opportunity to create a mini team for the sub-study. Now, this mini team for the sub-study can also be one of your mini teams or can be an entirely separate team. And their job would be to focus on the sub-study. And so that means they take data only for the patient involved in the sub-study, if that makes sense. So you have this particular mini team that sort of runs across or throughout the data collection period, and they are just involved in the sub-study. The reason why we want to identify these group of mini teams separately, I mean the sub-studies teams separately is because if we decided, or when we publish the data from the sub-study, we want to appropriately recognize those who were involved in the sub-study. And that's the reason why this is this way. Okay, data collection will be at patient level and will be at the hospital level. Patient level data collection will be for the main cohort study, which is what will be taken by MT1, MT2, blah, blah, blah. And then the patient level data for the sub-study is what will be taken by the mini team sub-study. And then also we have the hospital level data. We have the mandatory site survey, and then we have the optional WHO emergency assessment tool. So we'll be sending these to you at specific times. So the optional WHO emergency assessment tool will be sent at the beginning of the data collection period, and then the mandatory site survey will be at the end or midway through the data collection window. All right, this is just a timeline of the study. So far, we have about 1,005 hospitals registered from 113 countries. We still have lots of work to do, especially all these gray areas that need we need help to fill. So if you have hospitals nearby, especially rural hospitals where most of these operations take place, if you have colleagues there, please share the link with them, let them register as well. I think the strength in this study is the representative nature of the patients that we include in the study. So to mini team registrations. So far, about 1,300 logins have been issued. I would encourage us, or I would reiterate that most of these would go into your spam or your junk mail. So you need to have a look in there to find the link to register yourself. There are some hospital leads who've not had their logins yet, and mostly because we don't have all the complete data. So to register for the mini team, we need especially the patient group. We have most of the other things. We have a few missing emails. We have a few missing patient groups. And we have a few who have registered for multiple hospitals. So if you're a hospital lead, which is not a problem, because if you work in all these 3 or so hospitals, and you've put your name as a hospital lead for these hospitals, we are having a little bit delay in issuing your logins because we need to work it correctly. So we make sure that we don't have or we have specific people having access to only the hospitals or places where they work. So bear with, there's a little delay with those of you who've had multiple hospitals or you are leads for multiple hospitals. So I'll move just now to the REDCap registration. If you have any questions, please put in the chat and we'll get through to them once I'm just done with this. Can you see the REDCap screen? Can you please see my screen?
Yes.
Okay, thank you. All right. So once you get your login, I need to log in as someone else. Okay, so once you log in, you get your login, you set up your password, everything, you come to this page. Over here, you might have one of 2 projects. One might be Africa and Europe. The other might be Asia, America, Oceania. We've only divided it this way to allow us to administrate from here and then also to reduce the load on REDCap. Because if we put all these 1,500 hospitals into one particular portal or project, REDCap tends to be very slow. And so that's the only reason why we've divided it. It's not for any other reason. So if you are in Africa or Europe, you might find yourself in this group. If you are in Asia, America, Oceania, you might find yourself in the other group. There's no problem with that. So once you get to my project, you just come to the particular registration portal you have been allocated to. So I come there and then I go to record status. So at this point, I've not completed my mini team registration. That's why this looks red. Ideally, it should look green before data collection. So if you go and you click on the radio button here, it will take you to this page. Now, your hospital will already be uploaded and the patient group you selected at the time when you were registering would also be allocated. So this is the reason why some people have not had their logins yet, because during the registration process, this was not selected, or the patient group was not made known. And so we need to clarify that. And we've sent you emails to clarify what patient groups you want to collect data for. So if you answer that, we'll just fill that in and then generate your logins for you. So these are the only things that are pre-populated. The rest we need to fill out. So what class of hospital you're working in. And then at this point, you need to click which ethical approval scenario applies to you. Once that is done, you have the opportunity to, or you fill in your role as a lead and co-lead. So we've had a number of emails with people asking, oh, I spelled my name wrongly during the registration. This is a good opportunity to just rectify that. Or maybe during the registration, you forgot to add a co-lead. This is also a good opportunity to actually add a co-lead. But the main things are to make sure that your ORCID ID is correct. Otherwise, REDCap won't allow you to proceed. So as I'm filling in details for yourself and your co-lead or co-lead and hospital leads, you come to this area that tells you, okay, which periods are you selecting to take data for? We encourage everyone to take data for all the periods as much as you can. But if for some specific reason you may not be able to collect data for a particular period, then you select the areas you would take data for and leave that period out. Now, the moment you select any period to take data for that period, you are automatically allowed access to the sub-studies, because you cannot do the sub-study without being part of the main study. So say I'm gonna do all periods. So then you fill in the data for the collaborators. So we have up to 3 collaborators for each period. So for period 1, collaborator 1, you fill in their details. Collaborator 2, you add in their details. Collaborator 3, you add in their details. If for some reason you feel in your hospital you need only just 2 collaborators, you just fill in 2 and leave out the other one. All collaborators would get authorship, just like how the hospital lead and the co-lead will also get authorship. Same for the collaborators, but they will be recognized under the role they played during the study. So you complete this for all the periods you are taking part in, and then now you come to the sub-studies. So I said earlier on that the sub-studies are 2 of them. We have the financing sub-study and the waste management sub-studies. These countries or hospitals in these 7 countries are eligible to take part in the financing sub-study. and the waste management sub-study. Every other country can only take part in a waste management sub-study. So assuming I'm from any other country, I select other, and then I decide whether to take part in a sub-study or not. So you all have the option to take part in a sub-study. We encourage you to take part in it. But if for some reason you can't take part in a sub-study, you click no, but then yes, and then you now register the collaborators, just like you did for the main cohort study. You register the collaborators for the waste management or the sub-study mini team. And that will be the end of the mini team registration. Okay, I'll pause here, and then we can take some questions, and I will proceed. I'm just going to go.
Hi, Teddy.
Hi.
This is Alazar from Ethiopia National League.
Yeah, Alazar.
How are you, Teddy?
I'm good. I'm good. How are you?
Great. I just I just wrote it on the chat box, but maybe better to speak it out regarding
Yes,
the sub-study collaborators. How do you encourage the collaborators should be as much as possible similar to the one who are in the main study, or is it necessary to make it a different group of collaborators for the sub-study?
Okay. So the sub-study can be, I mean, the team making up the sub-study mini team or the collaborators can be different from the main study. We've actually allowed that so that it makes it easier, because then otherwise we are expecting the teams in the mini team, the main cohort study, to take data for that one and then also take data for the sub-study, which can be a bit difficult, especially for busy centers. And that's why we allowed for that, so that many people can actually take part, and then we can make sure we are actually getting right and quality data. So yes, if you have the manpower to have a different sub-study team compared to the main study, then please do.
Great, thanks.
Yeah. Please, if you have a question, you can unmute and then ask if it's not being covered yet, or if it's not clear, I can
Hello,
go
Teddy.
over it again. Hi.
I'm Ahmed Said from Egypt. I'm a co-leader of my hospital. I have a question about children and adults.
Yes.
When we enroll the many teams, they enroll for both children and adults, no separate mini groups, right?
Now, there were three options, so it's either children, adults, or both.
Sorry, I wasn't clear. My hospital now for children and adults, okay, in the site. But when I enroll the many teams, they gather the data about children and adults both, not separately, right?
For the mini teams, yes. So if I'm not sure if this would answer your question, but in certain hospitals or very big hospitals, you might have a pediatric department that is completely separate from an adult department, which means that it might be difficult for the mini team in the adult department to actually monitor and get consecutive patients from the pediatric team. In those cases, we've asked that the adult team registers separately from the pediatric team. In other words, in that particular hospital, you're going to have a hospital lead for pediatrics and a hospital lead for adults to make it easier to follow up. Because if for example, in some hospital, that is the same hospital, but the pediatric block is separate from the adult block, which means that it will be difficult for a mini team member who works in an adult block to actually collect data on kids that are operated in the other hospital. So in that case, the hospital registers the two departments separately.
Okay, I think I get it. I think my hospital do for both children and adults alike, no separation.
Okay,
Actually,
then,
there are another
yeah.
hospital that for children only. They enroll for only children, right?
Yeah, so there are some hospitals who have registered for only children. They only collect or they only record patients in that age group.
Okay, thank you.
You're welcome.
Hello, Teddy. I don't know if you can hear me.
Hi. Hi.
Yeah. Okay, this is Steven from Zaria, Nigeria.
Yeah.
Thank you for the presentation. Just for emphasis, for the mini team compositions, you said 3 per period of 8
3 per
periods.
period. Yes.
Okay, so does it mean mathematically you can have up to 24 data collectors over the period, over the 8 periods? Or does it mean
Yes.
we have to rotate
Actually,
3 people in between the 8 periods?
it depends on you entirely. So actually, if you are part of the sub-study, then you have a maximum of 27 people, because then you have 3 for all the 8 periods and then 3 for the waste management sub-study as well.
Okay, great. Thank you.
Yeah. Welcome.
Hi, Teddy. I have a question about the main
Hi,
study
Maria.
and the sub-studies. Will there be one publication or will it be divided into 2 or 3?
Sorry, I didn't get that, Maria.
If the main study and, sorry, I'm in a train. So if the main study and the sub-studies will be published as a one publication or will be there 2 or more?
It most likely will be published separately.
Separately.
Yeah.
And one more question. How
Yes.
many hospitals have registered so far?
We have about 1,545
I
hospitals.
will write it to our centers to motivate a little bit Austria.
Okay. Sure.
And what is the leading country?
Pardon me?
What is the leading country in registrations?
Italy. Italy is
Italy. I
dominating.
thought so.
Yes.
Yeah. Thank you.
All right.
Hi, Teddy. This is Navroz from
Hello.
Westnet. Can
Yeah,
you hear me?
Nakos. Yes, I can hear you.
Yeah, I just wanted to know that collaborators, when we put them on the main form to register them, what if after a few months someone leaves and wants to not participate and we want to get someone new in? Can we change collaborators at that time?
Yes, you have the login. So the hospital leads and co-lead have the login.
Okay,
But
and I can change them at any time I like.
No, not after we've started collecting data.
Before, you mean?
Yes.
So if I've submitted one set right now, but before the study starts, I want to change, I can do that.
Yes, definitely. For
Fantastic.
that particular period, yes.
Lovely. And for the ethical getting the permission and everything, I know it's a separate issue, but if you don't mind, I'd like if you can email me the whole study details so I can put it forward to them.
Okay, if you just send, we'll put the email on here.
Okay.
If you just send us an email, we'll just forward everything that you need to you.
Fantastic. Thank you.
Yeah.
Hello.
Hi, hello.
Yes, my name is Derek Mtembu from South Africa. Can you hear me?
Yes, Derek.
Yeah. Thank you very much for the presentation and the opportunity. I wanted to know whether is there a cutoff period to register the collaborator. Why I'm saying this is because, especially in our institution, we're anticipating that there might be delay in getting ethical clearance because our universities close, and we anticipate this, we might get it end of February or March. So does this mean we might miss to register for the first 2 periods, automatically, because we won't be having a ethical clearance? Do you have to wait then before we register the collaborators? That's the first question.
Okay. So what we've said is do not upload anything onto REDCap until you've actually got ethical approval from your hospital or your institution. What you can do is you can take data on paper, but then nothing should be uploaded onto REDCap until you have the approval, and then you can upload stuff onto REDCap.
Yeah, thank you very much. The second question, it means automatically in our institution, we might not participate in the sub-study where it compares open and minimally invasive, because we almost do exclusively all our appendectomies laparoscopically. Is that correct?
No, not entirely. So with the waste management, so the financing sub-study is looking at both. But even if you are not doing laparoscopic study, what we want to find out from this financing sub-study, for instance, is how much does it cost a patient to actually come through a system and they've had appendicectomy, what effect it has on them back home financially. So that's something you can do even if you're not doing appendectomy. Compare laparoscopic procedures. Comparing the open and laparoscopic appendectomy cost will be something that will be done at a hospital level, and then also at a patient level. So even if you don't have that, that's fine. You can still take part in the financing study if you are part of the countries that it's open to.
No, I actually said we exclusively do minimally invasive laparoscopic. We don't do open.
Oh yeah, that's fine. We still want to know what the effect is on patient in terms of catastrophic expenditure.
Thank you.
All right, welcome.
Hi, do you hear me? I have a question too.
Yes, I can hear you.
Bronius from Lithuania. I wrote several emails but didn't get an answer, so I have to ask a question in here.
Yes,
so for
please.
Ethical committee approval, for documents, we need principal investigator name, address, email, phone number, and even I would need his signature. Is it possible to get it somehow, or what's the path for getting that information?
That is possible. I think I saw that email earlier today. I would send you all the details that you need.
All right. Thank you so much. Okay.
You're welcome. Thank you too.
Oh, hello, Teddy.
Hi.
Can someone from another country participate in analysis of the data which gathered from all hospitals and participate in writing of the paper?
Sorry, I didn't get that.
I have a friend who have a lot of published papers, and he wants to participate in the analysis of data and writing the papers itself after gathering the data itself from all hospitals. Do you get me?
Yes, I get you. Yeah, I think they can write to us, get into the time, and then we can look at it.
Okay, just a CV and ORCID ID, right?
Yeah, just write to us and then we'll respond to that.
Okay, thank you very much.
Hello, Teddy.
Hi.
Thank you
Hi,
for holding this. Thank you for holding this meeting. I just have one question. I
Yeah.
have many doctors who want to participate in the study, but they are from other hospitals. My hospital has no problem with that. Is that okay or not?
So they work in a different hospital, but want to help to collect data in your hospital.
Yeah, exactly, because they are not holding such a kind of operation in their hospital. Is that okay?
I think, yeah, that's entirely up to the hospital lead.
Yeah, great.
If they are happy to do that.
Yeah, I asked the hospital, and I am a co-lead in the study, and they don't have a problem, and I don't have any problem. I just wanted to ask.
Yeah, I think the main thing is that a hospital lead or co-lead cannot be taking data in a different hospital where they don't work.
Yeah, exactly.
Yeah.
So the collaborator, is it okay? So it's only about the leader and the
As
co-lead.
long as the hospital lead and co-lead are okay and will be responsible for the quality of the data, that's fine.
Yeah, exactly. Thank you so much.
Thanks.
Teddy, this is Neil.
Hello.
I have a question about the main protocol.
Good afternoon, Teddy.
Hello, I think Neil was.
Good afternoon, Teddy.
Let him.
Yeah, hello.
This is Dr. Sanyang from the Gambia AFSTH.
Yeah. Yeah, I'm listening to the question. Yeah, I can hear you.
Hello? You hearing me?
Yes,
yeah.
I can hear you.
Sorry, I've been
Sorry, I think we've lost.
Okay, so this is Neil again. A few questions
Yeah,
about
Neil.
a few questions about the protocol. Initially, when the paperworks were being distributed about alligator study, there were consent forms and everything. There is no avenue to take consent forms, right?
No, so we only sent that out because certain centers might need it. Not every, just a minority of centers might need it as part of their ethics application. Most people don't need it. But then we thought we'll just send it around so that anybody who needs it can use it.
Yeah,
you don't need to use it if you don't need it. Yeah.
Because this is very similar in study to like the GECKO trial where you retrospectively collect the data and enter it. The only thing here is we are doing pediatrics and above 90 as well. So that's where our IRB can get a little tricky.
Oh, okay. Yeah.
One thing I think Derek was adding, our IRB will take time and we will not be able to join by February, most likely. But retrospectively, we can fill up all the data, right? If we data from our electronic health record and retrospectively fill it. Okay.
Yeah.
And there is no need to collect data for people who were admitted with appendicitis but did not have surgery.
No. It's only for those who've actually had surgery.
Okay, thank you.
Yeah, thanks.
What happens to the data where we do like the preoperative forms is very difficult to collect retrospectively, like whom did they see before coming to the hospital? If it is left blank, it's okay.
So I think as long as you have, so if you've submitted, so if you look on the REDCap form, we've put here, for example, if you have applied for ethics, but you are just waiting for the answer, and you know that you will get it, you can take all those data on CRF. So on the CRF, there will be options to put in all that data about what happened in the before they came to hospital. So I think it's, if you've applied for ethics, you're waiting for ethics, you know you get it. You start the data collection from the first period, even though you're not uploading anything to REDCap. You're just filling the paper form so that once REDCap is available, you can just upload those parts onto REDCap. So I understand that you have maybe an electronic record where it captures certain things intra-op and post-op, but not necessarily pre-op. So what your mini team for that first period can do is take the data that they can't get or that's not recorded on your electronic record, so that once you are ready to upload it, you can upload it to REDCap, if that makes sense.
But that would mean that this becomes almost as a live prospective study.
Yeah, it is a prospective study.
Okay. So
Yeah.
you would suggest like on like period 1, when we start collecting data on February 2025 or 3rd February 2025, there should be a volunteer to fill this form up
Yes.
on 3rd February.
Yes. Yes.
Would it be
Otherwise,
okay?
yeah.
Would it be okay to do it retrospectively or no?
No, but it's difficult to get it retrospectively, like you said, for some of the data points.
Means most of these data will be like scanned in somewhere.
Okay.
Uh,
All right.
so
As
like
long as you get the data. I
yeah,
only said that because you mentioned that it will be difficult to get some data from the
yeah.
electronic records. So if you are going to get that data, access to that data, then that's it.
Yeah, we should be able
Yeah.
to access the data, but that's what I was assuming. Like, if we go through this IRB process, which will take us at least 3 to 6 months time, and in the summer of next year, we can retrospectively fill up all the February, March, April data.
Yeah.
Okay, thank you.
Yeah. You're welcome.
And one more question. Last year, because of on the Gecko trial, lots of WhatsApp groups were made, and we could ask small questions for the Americas, for the Europe. Would the same thing happen?
Yes. Yes. So we already have some in place. So we're just sorting out the rest. 2 regions more.
Yes, if you can share those links, maybe. Yeah.
Yeah, via email. We share it via email.
Okay.
Hi.
Hi.
Okay, my name is Fumi, from the Canada Center. So I just have a question. You mentioned something about the consent form. You said, though we need it for the ethical approval, which we are using it for. You mentioned that's what we need the consent form for only. That's why we got the consent form. Don't we need to consent patients to actually participate in the study?
So if you are registering, depends on how you are registering the study. So
Okay.
in certain centers or in the UK, US, for instance, we are registering it as an audit. If it is an audit, you don't need to take consent from patients to do the audits. Now, in other areas where they are taking part in the sub-studies, for instance, the financing sub-study will require that you actually ask patients certain questions. In that case, you need to consent them to be able to do that. But if you are registering it as an audit, which we'd expect most high-income countries to do where it's allowed, then you don't need a consent form.
Oh, all right. Thank you.
Thank you for me. All right. Any other question?
Yes, I have a question.
Hi, Hussein.
Hello.
Yeah.
I would like to ask you, like, we have 5 consultants in our department, like 5 surgeons. Do we have to take all the patient coming with the appendectomy or appendicitis?
Yeah, if it's the same department, yes, we'd want to get consecutive patients presenting to the department with appendicectomy.
But in each period, there is just 3 doctors or 3 students taking part in that. I told you we have 5 consultants in our department. And in each period, there's just 3 people to take the clinical notes of the patients. Like
Yeah, so is it the same department, like
yeah,
as in the
it's
same
same
department?
but with the 5 consultants, not just the
No,
3.
yes, I understand that. And because in the UK, for instance, you can have like 10 different consultants in the general surgery department, and they'll come on call at different times. But then once we are taking the data, you take the data over the 2-week period. Any patient that actually came with appendicitis and had surgery, you take those data. You don't take the data based on which consultant is on call, but which patients presented to the department with appendicitis and had appendicectomy.
Okay, got it. Thank you.
Yeah.
Also, like our doctor told me that they can't like fill the information in the computer, so they will take a paper and fill the information. So can I log into their account and fill their information, the patient information, patient data?
Okay, are you a hospital, a co-lead, or?
I am a co-lead, yeah.
So all the co-leads you'd have access to the same mini team portal as the consultant lead.
Okay, I got it.
So
Also,
then you should be able to do that. Yeah.
So the doctor can fill the papers and I can fill the information, their data, right?
Yes, as the co-lead, yes, you can. So if I get what you're saying, are you talking about when we start taking data?
Yeah, when we will start taking the data.
Okay, okay, I misunderstood you then. When we start taking data, all the collaborators, all the members of the mini team will be issued logins so they can enter the data themselves. So they don't need to bring it to you, the co-lead, to enter it. They can enter the data directly themselves.
Okay, got it. Thank you.
All right, you're welcome.
Will all the mini teams also get authorship? Because most of the faculty or
Yes.
consultants are not interested in research. So I
The mini
understand.
team,
Yeah.
they will get authorship. Okay, any other questions, burning questions? Okay, I see my colleague Maria has answered most of the questions on the chat page. Yes, hello.
Yes, Usman from Gambia. I was saying I was coming in and out due to connection problems. So I had somebody inquired about having the pediatric set and the adult set.
Yeah, sorry,
where we admit pediatric cases, like I had you mention, it's away from. Hello.
Yeah, Osman.
Yes,
sorry,
sir.
the line keeps breaking. Yeah.
Yeah. Okay. Are you hearing me now?
I can hear you now.
Yes. So the place where we admit our pediatric cases and the adult cases is a distance apart. So if I hear you well, you were saying that we can register separately, the pediatric group and then the adult group. Is that right?
Yes.
Okay.
That's right.
In both, they would have a lead and a co-lead.
In both, they'll have a lead and a co-lead.
So if we have registered already for one, we can redo that because we have one from the adult set, one from the pediatric set to have the lead and the co-lead. So
yes,
is it possible to redo that and have the adult lead and co-lead and pediatric lead and co-lead?
So the one you've already submitted. So if you've submitted that you were taking data for adults, that's fine. You leave that, and then you get the pediatric, your pediatric colleagues to fill in another form to say that they are taking data for pediatrics. So the most important thing is indicating the patient group, because otherwise, once they don't indicate a patient group and they also put adult, then it becomes a duplicate. In which case, for most instances, we end up just allowing
So can we have because like we have the lead was in the pediatric and then the co-lead was in the adult. So now is it possible to have one where because we did it in such a way that we can have both adult and pediatric patients.
Yeah.
That was the purpose. Yes.
Yeah.
So now that you have enlightened us, how should we go about it? Having submitted already this one,
Okay.
which is a combination of both the adult and pediatric. Yes.
All right. So you let the adult team, because the pediatric team is the one that registered for this one. So let the adult team also register. And then when it's the pediatric person, your pediatric lead is filling in the consultant's lead information, they can put in the co-lead of whichever co-lead they wanted to include. And then once the adult person registers, once they get to this point, they can also put in the details of whoever is their co-lead in the adult center.
Okay. Okay.
It will be also
All right.
very
That's fair enough. Thank you so much.
yeah, but it would also be it will be useful if you send an email to us, because if the first person or if the first registration said that it was both children and adult, that needs to be changed to only
Yes.
children only. So why don't you
Okay.
send an email to us and then just say this is the situation, and you've put in a new registration.
We'll do. Yes, so
Thank you.
we'll do that.
Thank
And
you
then
very
is
much.
it possible to have where you have co-lead in both of them?
Yes.
Like the co-lead here already is in the adult surgery group, and then you have the already his name is in the pediatric group. That you said we should leave it for the pediatric group and then add the register for the adult.
Yeah.
So you can serve the same person as a co-lead in the adult group as well.
Yes. Yes.
All right. Okay. All right. Thank you so much.
Thank you.
Sorry, just to say that, like, I have not had I was off when you were explaining in detail, but probably with regards to the REDCap and other this, and then probably I might have to send an email if I encounter some problems for me to be guided.
Oh, okay. We are recording this. We are recording this Zoom anyway, so you can
so the
look at the
recording will be
recording.
sent.
Yeah, and also in
sure,
addition, we've sent around a PDF for those who have been given the
Okay.
login, so they can actually look on the PDF and then also follow it if that's easier.
Sure. All right. Thank you so
All right.
much.
Thank you.
Hey, Teddy.
Hi.
There will be a group of leaders and co-leaders to communicate with each other about the problems or matters they need, or just the Zoom meetings.
Which country are you from, please?
I'm from Egypt.
Okay, so there is a sub-Saharan Africa group, and there will be a North Africa group as well, North Africa, Middle East. So you would find yourself in a WhatsApp group with other hospital leads and co-leads. So that'll be a good chance to actually discuss, and any soft questions you have, you can put it on there.
Okay, the group is not created yet.
No, for North Africa, no.
Okay, thank you very much.
All right. Okay, in the absence of any further questions, I'm just going to quickly, so yeah, so certain key actions to highlight. Ethics. I know ethics has most of you have already started the ethical application. For those who haven't, would entreat you to start. And then if you need a data transfer agreement, please get in touch, and then we will send you a draft data transfer agreement. You can have a look at or you can run it by your legal team. If they want any modifications, you can track those changes and send them back to us, and we'll run it by our legal team. And also the mini team registration, we've already highlighted that. And then dissemination of the study. If you can, please share the study link with your colleagues in other hospitals who haven't registered yet, and then also in WhatsApp group or social media. We'll be grateful. Any other questions? Otherwise, we'll call it.
Yeah, I have just one question, please.
Hi.
My doctor name is not written in the list of his first name not written in the list of the lead and co-lead. Will be that a problem or no?
You have the option, you have the chance to
Yeah.
rectify that at this point.
Okay. Thank you.
So you can put in the correct name. So if you've had any mistakes in your name or a particular name has been omitted, this is a chance to correct all that.
Okay, thank you.
All right, thank you. I'm just going to go quickly through the chat to see if there's anything that is yeah, so there's a question about the sub-study. Like I said, the sub-study similar to the main cohort study. As a hospital lead or co-lead, you do not necessarily have to push yourself down as part of the mini team. If you wanted to, that's fine. But then you can get other residents, registrars, junior doctors, medical students who actually take the data. But if you really want to do that, then that's fine. You can do that. And also, if there is any Australian leads online, Prof. Dawson has asked that you can message her with any questions you have. If there are no other questions, I can't see any raised hands. We'll call it a day. And in the next hospital leads meeting, we are going to we'll touch on mini team registration again and ethics again, but then we'll zoom more into the sub-studies and then explain exactly what is needed for the especially the waste management sub-study. Okay, all right. Thank you all very much. If you have any questions, once you are on the WhatsApp page, you can ask that and then we'll respond as soon as we can. Thank you all very much. And thank you to the team.
Thank you so much. It's a pleasure.
Okay.
Bye.
Goodbye.
All right, bye.
Thank you. Have a good time.